As the Chief Medical and Quality Officer for our health system and for Robert Wood Johnson University Hospital, it is my job to set the standards of care at all of our sites and to measure the quality of care delivery. Robert Wood Johnson University Hospital delivers the highest levels of care available in the state of New Jersey. Our faculty and physicians perform complex medical interventions that require specialization from our nurses and the entire team of health professionals that support our physicians and our patients. When the hospital developed its plan to continue full operations and to provide all medical services during a strike, the list of specialized nursing skills and certifications was significant. Our nursing leaders meticulously worked with their counterparts at national nursing agencies to ensure all patient needs were met in the event of a strike, which did occur on August the 4th. My physician colleagues and I could not be more impressed with the expertise of the replacement nurses who are caring for our patients today. From the ORs and procedural areas to the inpatient units and our ICUs, our patients are receiving exceptional care. These nurses have trained and practiced at some of the most prestigious hospitals and medical centers in the United States. We are thankful to have them here, ensuring uninterrupted services for our patients and the communities we serve. Additionally, the key indicators that we track reinforce the quality and safety of our clinical delivery with our replacement nurse colleagues. The data show that we are meeting or exceeding standards. Furthermore, our hospital and health system are committed to maintaining this level of nursing support for as long as necessary. I am enthusiastic to report that our patients continue to receive the exceptional care that they deserve. Thank you for entrusting us with your care.